Good morning and welcome. I am Dr. Peter Holmes, orthopedic surgeon, and I am host of your program, Ask the Doctor. My guest this morning is Dr. Joseph Diaz. Dr. Diaz is an allergist, immunologist, and asthma specialist. If you have any questions for Dr. Diaz in the future, there's two ways to reach us. Do it through the foundation. That's www.needfoundation.org or fax 696-9012. Well, what does socialized medicine mean for your health? And a lot of you think, well, we don't have socialized medicine. I guarantee you it's fast approaching. Recently with the new administration, we've expanded CHIPS to include families making up to $85,000 a year. The new proposal is to drop the age that people can get Medicare down to the age of 55. So you can see how we're going from the bottom up and from the top on down. And it won't be long before pretty much it's potentially all that way. So you think it's a gift horse? I think it's a Trojan horse. Folks, healthcare is 17% of our gross domestic product. 17%. You think, well, we spend a lot on health, but you know what? We look pretty good for it, at least those of us that try, those that want to carry on. 17% of your gross domestic product. So in my opinion, what's going on here is you've got a hungry Congress and president and all that want to grab 17% of the gross domestic product and control it, in addition to what they already control as far as income tax, Social Security, and Medicare. Think about it. If you add all that up, it puts it to 62% of the entire GDP. That's a lot of power. Now, in doing this, a lot of you think, well, I'm going to get somebody else to pay for my health care, which is what socialized medicine means. One person's paying for somebody else. The government doesn't have money unless it takes it from somebody and gives it to somebody else. Well, they're not just going to give it. See, it's going to be monitored through electronic medical records and other things, but they also are talking about some sort of health council to decide what is the most cost-effective way to distribute it. I've heard rumor coming through my academy, they're talking about not allowing total knees, for example, until the age of 65. Just gives you a hint as to what's heading that way. So if you look at how these councils work in other one-tier systems, such as England, in England, for example, they have this, and if you have macular degeneration, in the year 2006, you had to be blind in one eye before the council would allow treatment of the other eye. That's because it was cost effective. So what if you can only see through one eye? You're 65, probably not working and not making taxes anymore. If you go to Canada and go to the Manitoba, which is a pretty good sized province and has the population of San Antonio, there's 6 cardiovascular surgeons in the whole province. Each one is allowed to do 3 cardiovascular procedures a week. Can you imagine something the size of San Antonio and the surrounding area, and you're allowed to do 18 cardiovascular procedures a week, and that's it? But that's what the council deems, and that's cost effective. Boom. What's even worse, in Canada it's illegal. You say, well, I can just go around and pay for it. No, you can't. It's a one-tier system. It's illegal to pay for your health care in Canada because it's not fair to Jacques that Pierre can buy his care. Folks, my opinion, if you're looking at socialized health care as being free health care, what you're basically buying is a Trojan horse, a lot of government control, where they get 17% of the GDP. In my opinion, it's more about power than it is your health. These are my opinions. If you have any comments, 2 ways to do it. Do it through the foundation, www.needfoundation.org, or fax 696-9012 to ask the doctor.
Hi, I'm Danielle. I injured my knee back in February, but thanks to the foundation, I'll be playing again.
I'm Dr. Peter Holmes. The Orthopedic Need Foundation was formed to help those families who are underinsured or uninsured return their athletes to their sport. Please help us to return kids back to their sport after injuries like this.
You can send your donations online at www.needfoundations.org or call 210-542-1722. All donations are tax deductible. Make a difference in